these people with ADHD, they've always existed, but it's just that they're in a much more stimulating, distracting environment now.
I think there's a danger we're going too far maybe with the language.
When individuals have these conditions, the risk of having certain mental illnesses are far higher.
I think this is going to be as controversial as the first one. Hello and welcome to Perspectives, a show from Priory where we talk about the biggest topics in mental health and addictions today. I'm Colin Quick and I'm Priory's Chief Quality Officer, and in this episode we're going to be talking about ADHD and autism, an area that has really seen a huge expanse in the number of diagnoses and treatment options and services over the last number of years. Now today I'm joined by a panel of experts, and I'm joined today by Dr. Samir Shah, one of our consultant psychiatrists and medical director, Dr. Dave McLaughlan, consultant psychiatrist, and Debbie Longsdale, our director of therapies. Welcome everyone. It's always useful, I think, at the beginning of these is just to put some context around this, and I think just give our viewers just some of the scale of the developments around autism and ADHD. So just to put some numbers around this. So a study from 2021 showed a 787% rise in autism diagnoses between 1998 and 2018, so a 20-year period, huge increase in diagnoses. In 2023, ADHD was the second most viewed condition on the NHS website. And what we're really going to try and take is that this discussion is going to aim to explore our awareness of those conditions and really what support we can provide for those, for the knowledge of our viewers today. So, we can see there's a big demand's increasing, diagnosis is increasing. Samir, why?
Looking at the 700% plus increase sounds a lot, but we have only learnt about these conditions, ADHD, autism and similar conditions, maybe in the last 2 or 3 decades, and we are learning with every year passing more and more about it. So instead of us looking at increasing in it, is it more awareness around it? Also, the numbers are increasing probably due to we are learning more about it. There is better acceptance and acknowledgement of these conditions. There is a lot more improvement within the diagnostic criterias or symptoms, as we say, or signs. And also we have a lot of evidence around if there is some support put in place, individuals' lives could be far more better than others. So we have seen the whole spectrum. But I also think that when we had COVID pandemic, many people who were in isolation and had these conditions not diagnosed, they struggled because there was increased anxiety, depression, social anxiety and adjustment difficulties, and they wanted to ask for help for these conditions, for anxieties and others, but they found that it was something else. However, there were also some patients or individuals who had some of these conditions thrived in those environments because there was less stimulation and others as well, and they wanted to know why that was different. So I think there are multiple of factors, increasing understanding of diagnosis, acknowledgements, the support that is in place as well. And now we all are talking about it. And there's probably less stigma attached to it than what it was before.
Brilliant, thank you. I just want to move to Debbie now. And Debbie, actually, you started talking about it just now. There was that discussion, a piece around the relationship between neurodiversity, mental health, and mental illness, and what that is. What's the relationship? I mean, is neurodiversity a mental illness? Is it not mental illness? If I'm neurodiverse, can I have a mental illness? Can I become unwell? What's the interaction and the interplay here? Because I think that's often confusing.
So we see people who have a neurodiverse trait or diagnosis who then, because of their navigation of the world, have developed a mental health condition, so generally anxiety, depression, etc., or relationship issues, and we can support them with that. I think it's probably wrong to say that because of anxiety you would create neurodiversity. That isn't, we wouldn't go that way because that is a more biological thing. So that's probably good to identify. But the neurodiversity is a condition, i.e. your brain is wired differently, therefore you see the world and you compute the information differently, back to the whole Matrix kind of film in terms of how that works, which always fascinated me, the idea of having all that information in front of you. And that can lead to, therefore, mental health conditions. But I know that in the therapy room, we've talked a lot about this over the last few years, how there are some people that we're training more in neurodiversity, and they're reflecting on people that they've worked with 5-10 years ago, and they're saying, actually, I thought it was anxiety, but I've realised now with my new information and my new reflections that probably what I was seeing in the room was actually neurodiversity, and it was causing anxiety because of the way that they were trying to deal with it or communicate it or navigate it. So I think our awareness around what does a neurodiverse person present in a therapy room or in a doctor's room is growing.
It's interesting with that therapy observation, isn't it? Same thing happens when I started working with ADHD and autism to some degree, is I was thinking how many I may have not recognized before. But the important part here is that having autism or ADHD is not a mental illness. However, when individuals have these conditions, the risk of having certain mental illnesses are far higher than general population. For example, individuals who have autism may have 10% risk of having schizophrenia as opposed to general population, which is roughly about 1%. In ADHD, there's a higher risk of having bipolar illness, which is biological, about 20-odd%, nearly 20 to nearly around that same as depression. Anxiety is nearly 1/3 or 30 to 35%. So there is some overlap in whether it's in the genetics or the environment and others, that some of these individuals are at a higher risk of certain mental illnesses. But again, it's not 100%. It's 1/3 or others. So as we learn more about the overlap between different genetics and the environmental interplay, we might get better understanding. Absolutely clear is it's not the other way around. You can't cause ADHD, you can't cause autism. Yes, there are various papers talking about different things, but there's no convincing evidence that you can cause these problems. It's a condition that the brain is with.
Okay, it's really interesting. So I think that we're definitely going to start exploring about what these conditions are. What are people looking for in this? But one of the things that we do here is that there's particular groups. There's groups in society that are more likely to be neurodiverse. One of those issues you quite often see sort of underreporting within the female population as well. David, what does that look like? As a broad scope, are you more likely if you're male? Are you more likely if you're female? How does that look?
So if I break it down into underdiagnosis in ADHD versus underdiagnosis in autism. So first of all, with underdiagnosis of ADHD in women, one of the reasons perhaps for that is because women with ADHD tend to present with more of the symptoms relating to difficulty with concentration, whereas it's more common in male patients to present with hyperactivity. And so maybe 10, 15 years ago, we would see in kind of clinics for children, you'd have these very hyperactive boys that were presenting because they were causing distress to teachers around them, the parents, and they were getting identified early at school because they were causing distress to people around them, and kind of being very fidgety, restless, kind of climbing up the curtains. But the quiet, daydreaming, distractible female patient wasn't causing any. It was very easy to overlook them. But it's only really now in the past, I don't know, maybe 5-10 years that we're starting to recognise these late presenting female patients with ADHD that are still experiencing enormous amounts of distress, huge amounts of distress. But it's just that it's not been recognised because the way that their symptoms manifest is different. With autism as well, one of the theories is that women tend to mask their autistic traits more, and they're more likely to try and conform and feel that pressure because of what society expects of them, whereas maybe there's more allowances for boys to be direct with how they communicate and the way that they behave, whereas one of the theories is that there's societal pressures on women but also that they may themselves feel that kind of pressure to I guess, to mask their symptoms.
And is there anything, and it might be useful to understand, and maybe for yourself, Samir, is there anything particularly that has power? So there's power in understanding the diagnosis for the individual, but say I'm a parent and I want to take my child along, and is there something that a diagnosis leads to? Does it support schooling support? Is there something that's very tangible in that way?
It is. So even if it is a condition, it does need help and support because they have to adapt to what we have around us as well. So having a valid diagnosis, which is comprehensively done and covers most of the aspects, helps schools for children who have these conditions to adapt their learnings, adapt their school environments, put in more support, give the chance to those children to perform equally, if not better, to other children. You just need some adaptation. So it is absolutely critical to have that in place. For adults, just having these diagnoses, apart from validation and not feeling that they're lazy or that shame and others, it helps them to adapt to their work environments or choose certain working conditions that's right for them. For example, someone with ADHD, and if you give them with hyperactivity, an administrative job, they have to sit at one place and do it, they will struggle. Give them a job that they have to run from one end to another every time, they will thrive in many cases. So it helps them understand about what kind of work adaptations they may need. But it also reduces a lot of anxiety, feelings of overwhelm, the negative feelings, and thereby less of mental distress and mental disorders in itself. The family relationships improve because they're able to listen, talk to, adapt, and also overall their self-esteem and confidence grows as well. And it's both for autism as well as ADHD. Now, ADHD, the reason for diagnosis again is it has treatments. Doesn't cure it because there's nothing to cure, but there is treatment that can improve the management of ADHD, and thereby people could function far better than what they were doing before. And there are certain therapies, certain group therapies, certain other psychosocial educations. For autism, there is no treatment in terms of medications, but understanding about how you perceive the world, and it's okay, and there are different ways of managing it. Reducing the sensory load that some of these patients might have can have remarkable outcomes. Some of the best CEOs, doctors, lawyers, nurses, mums and influencers have these conditions, but they have got support to understand these conditions. That's why we see in TikTok, Instagram, a lot of these people openly coming out with their conditions and sharing, and they're doing very, very well. But it's the understanding starts with some treatment.
Just whilst you were talking about, the social media side of things, actually, I do wonder if that's why we're seeing a lot more presentations in our clinics, people coming asking for particularly ADHD diagnosis, because it is talked about so much on social media like TikTok and Instagram, and funnily enough, people who have ADHD are often drawn to the intense stimulation and short kind of this kind of short kind of stimulation of social media. And I wonder if that's kind of partly why people are so much more educated on it now, but also, again, on the theme of social media, the world is so much more distracting now. There's so much more stimulus. So I do think that these people with ADHD, they've always existed, but it's just that they're in a much more stimulating, distracting environment now. The world that we live in now is much more distracting, which makes it more difficult. But I always say to my patients who come for an ADHD assessment, be really careful about what you see on social media, TikTok and Instagram, because there was a study done by the Journal of Psychology in Canada, I think it was, and they showed that about 50% of the content on social media that related to ADHD contained misinformation, or it was overgeneralized. It was one person's personal experience of ADHD that they had overgeneralized. And the thing that makes social media go viral is the generalizability of it. It's the fact that it's hyper relatable. So things like losing your keys, that doesn't necessarily mean that you have ADHD, but there might be a really funny TikTok reel, and it goes viral because it's so relatable, and all of us can relate to things like, I don't know, running out the door but realizing that you've forgotten something. So I always say to patients, take what you see in social media with a pinch of salt.
For our viewers, one of the pieces is when you're, particularly I think for parents have become, as the awareness of neurodiversity has increased, parents become much more aware. And going to David, your point around, there's a lot of information, there's a lot of partial information, misinformation, challenges around what's there. I want to give them something to kind of hang their hat on about what is it, what actually we're looking at, because we've talked, we've got a knowledgeable group here, but we've not talked exactly about what is autism, what is ADHD, what does that look like in a child or in an adult. So I just want to just pull those apart a little bit. So I'm going to start with Samir. So give us just a couple of minutes on autism. What does that look like?
So the autism, mostly, whether you look at children or adults, the general patterns there would be that if you find someone having quite rigid structures, because without that they would not be able to function properly, or they have repetitive behaviors, for example, getting up at a particular time, having a set routine that they have to follow, or go to a shopping mall and spend exactly £2.15 every time, and if there is any change in that structure, there will be meltdown, overwhelm and others. That's one of the very important indicators to say, is there something going on here? The social interactions, it's quite difficult for someone who have autism, and again it's got a spectrum with it, but they may struggle to relate to individuals or understand the social cues or emotional feelings, and they can't recognize it easily. They can learn and they become really, really good at that. So they know when someone is angry, not because they've seen anger or felt anger, they just think, this means when they have some frown and others, it will be. So they learn through it. When that happens, there's something to be looked at. Also, they struggle to start or maintain friendships and relationships. They may be perceived as rude at times, arrogant or dismissive. Then there is also non-verbal, which is quite a small number of people who have autistic spectrum disorders or conditions, where they're generally mute or don't talk much. But after the age of 10 and so, they might pick up their speech and others as well. With that eye contact, they struggle to create and maintain eye contact. But some really learn how to make eye contact, but they're actually looking at beyond you at a certain point to keep their focus going on rather than at you. And they really struggle because they can't engage with it. Empathy can be a difficulty. So sometimes you might find saying, why does that person not even understand what I just said? Why don't they understand that I'm really upset? Because they can't evoke those feelings. They don't know what those feelings are. And the main thing is around that rigidity, having restrictive intensities. They can go into hyper-focus. The other one is the interest. As a child or adult, if they develop an interest and they know almost everything about it, to the end that, wow, how did you even do that? But something else, they would have no idea about it. Then you start thinking about, is this autistic spectrum condition or something else related to that? But those are the general patterns you will see within autism.
Thank you. Really helpful, really good pen picture there. So we're also talking ADHD. So David, give us a couple of minutes on ADHD.
Okay. So the brains of people who have ADHD are different, like we said. They are structurally and functionally different. So if you were to put them through a MRI scanner, they would look different. And one of the key differences is there's a lack of a neurotransmitter called dopamine in the prefrontal cortex. So that's part of your brain. And the way that this manifests is difficulty with sustaining concentration, and an increased propensity to be just basically more distracted. And so what that can look like in school settings or work settings is people really struggling to finish tasks. So they might start a task, but really struggling to finish that, and starting one task, but then moving on to many others. So there's the difficulty with concentration. The other kind of key characteristic as well is impulsivity. And that, again, that's due to this deficit of dopamine in the prefrontal cortex. So I've heard people describing the brains of people with ADHD a bit like having a Ferrari engine but bicycle brakes. So they're moving very quickly. The thoughts are moving very quickly, but there's no brakes. They've got this Ferrari engine, but bicycle brakes. And that's because of lack of impulse control. So they might say something and speak out, say something without thinking, or do something, touch something, again, without thinking about the consequences. And so in the school setting, often these children with ADHD, they get in trouble because they're the ones that, think this is a really great idea to shout something out in the classroom, and they struggle to wait their turn, they struggle to wait in queues. In adults, that impulsivity might look like kind of just getting really frustrated and difficulty being patient, or in conversations, speaking over others, because again, it's that Ferrari brain but bicycle brakes, so they blurt out what they want to say. And then the third symptom, we've talked about the difficulty with concentration, the difficulty with impulse control. The third symptom, or the third experience, is hyperactivity. So often, again, in a school setting, you'll see children that are really fidgety, swinging on their chairs. Again, I've actually seen this in clinic. I've seen children try and climb up the curtains. But in adults, it can actually cause quite a lot of embarrassment. So again, I've had patients in my clinic tell me that they go out for dinner, but they don't realise it, but they're tearing up their napkin, or they're tearing the label off the drink that they're having, or they're playing with the candle because they're fidgeting and they're making a mess, and it's embarrassing. And they'll sometimes have to sit in their hands even, because they know that they're fidgety and restless. And it sounds like a small thing, but it can cause enormous distress. So that's kind of like an overview of those kind of three symptoms: the difficulty concentration, impulse control, hyperactivity, and how that can manifest from childhood through to adulthood.
So along with that, I think, if you agree, John, as well, the individuals with ADHD can also have difficulty in managing emotions and emotional dysregulation, as it's called. So they can have mood swings going during the day throughout, which is not the mood illness itself, but they struggle with that part. So they can become very angry or upset, or suddenly the mood is very down parts. And the other part is the cognitive aspect, or the thinking abilities and the frontal lobe that you said. I call it the CEO of the brain. The CEO is fully capable, but it doesn't have the other part of the team that can empower the CEO to work properly. And those are the couple of things that is being looked at in research a lot. We definitely know about these three broad symptoms, but people who come to clinics a lot of time, adults mainly, are coming because of the other two problems, because they struggle with that part.
Brilliant, thank you. And I was just thinking then, as you were just talking, Debbie, and that bit around people getting to understand it and know it, and it came up in the bits of you talking about the sort of things to look out for. One of the fundamental questions, and I suspect people get asked this a lot: why? Why does someone have autism? Why does someone have ADHD? So, David, you talked a bit about some of the structures and the functions of the brain in ADHD, but why?
So the short answer is genetics. So there's been twin studies where they look at identical twins who have, essentially the same DNA. And something like 70 to 90% of the time, if you have one twin with ADHD, the other twin, and the same with autism, the other twin will also have autism or ADHD. So largely it is genetic. I know that, again, if you look on the internet, there's people that will talk about trauma and epigenetics. I'm not so sure about the evidence for that myself. There's also other evidence that kind of traumatic births, so like maybe very premature births as well, or if there's a lack of oxygen at birth, that can kind of cause those changes in the brain as well. But the short answer is it's a very genetic condition, and that's again why we often see several people in the same family with autism or with ADHD. And actually one of the really interesting things I've seen is I've had mums that have had ADHD their whole life, and then their child has now managed to get an ADHD diagnosis, and the mum's like, oh my gosh, all this time I just thought this was like, I didn't realize that this was a symptom of ADHD or autism. This is because this is the way that I've experienced the world, so I didn't realize that this was different until their child had the diagnosis. And then that's what often prompts the mums to come to our clinics. And again, it can be really interesting, kind of, I think, a positive experience, again, to get that validation that this isn't the way it has to be all the time.
I guess that's also where that bit we talked earlier on about that almost the diagnosis is the foot in the door that starts building the understanding as well, isn't it? But it can actually be, and David, you so eloquently put about people, one person, then someone else says, actually that could be me. And then someone else says that could be me, and then you start developing that whole understanding, and then you start looking at that collective strengths, aren't you? And I wanted to kind of build on that a little bit, because we've talked a bit about, you know, what it is, what we know about it, the emerging trends around it. It's getting to that point about, and so what's that support look like? And you've all at different times started talking a little bit about, I guess, particularly for your roles and your expertise, what is it that you do? So Debbie, you started talking a little bit earlier on about the role of the therapist. Could you expand on that a little bit? And also I think really useful to think about that long-term piece that therapy can work with as well.
So I think the initial gift that a therapist can give to an individual is an understanding and non-judgmental fact summarising, here's who I am as a human being, and that can and just to be heard and be validated and understood. That is in itself a currency and a really huge piece of work. And then we very much focus on the strengths. Okay, so this is what's going on for you, and you might use the language condition or traits or whatever you feels happy for you. And then we would encourage people to frame that in a way around, okay, what does that mean for you then in terms of what you can focus on? How do you use these abilities? So like you say about jobs and things that you might think about, you know, you'd reassess what you're doing in terms of your job or your studying, or so we kind of go on a bit of a journey with people really in terms of understanding all the different jigsaw puzzle that is your life and what makes sense and what doesn't make sense. It can be difficult because you're also then offering the challenge of, does something need changing? And if suddenly your relationship is tricky or your job is tricky and you're in your 30s, 40s, 50s, and that's a really big thing to try and challenge, then you've got to be really careful how we navigate that with people. So we don't want to kind of put a bomb in their life and then say, well, okay, just change everything to suit your needs. So it's doing a bit of a discovery phase with people, but it's always strengths-based and always focusing on how can you make that the best that you can for you. So if you're really good at hyper-focusing on something and you really enjoy collecting something or knowledge about, I don't know, I can't think of a topic, something that you know you'd really enjoy knowing more about that, and maybe you might go to conferences or you might share your knowledge with other people, and then you'd have value in what you can do. So depending on where somebody is on their own journey, it's all about understanding it. What are the strengths and what can we therefore do now? What are our choices? What can we impact? And then helping them with their future sort of life script kind of work.
There's a really important role for the therapist. We talked a bit earlier on about the diagnostic role for the consultant psychiatrist, but just want to pick up with both of you from your practice, and we'll pick up a bit from ADHD and a bit from around autism. So, Samir, what's the role of the consultant psychiatrist with someone with autism?
The role of the way I see it, because it's a condition that we don't have many medications for, or at least now, because I don't see a role of it yet for it, unless you got associated mental difficulties, disorders, and very close. So you're treating the other aspects of it. The main role is, of course, to support. It's an MDT diagnosis or multidisciplinary diagnosis. So you work along with the team to make sure that you have covered all the aspects of that assessment. But also a very important role for consultant psychiatrist is to identify what else is going on apart from autistic spectrum condition, because it's one particular, along with ADHD, they usually don't come alone. They come with a bag. So I always look for where are the other suitcases or luggages that we haven't noticed, and that's where the consultant psychiatrist can make a huge difference. Also guiding them or directing them to the right people for support, such as therapy, psychoeducational work, groups, support networks, because what some of the individuals learn the most is from groups, not from a medical model of different things. And the interesting bit with autism is that once there's an individual who has got a liking for something, they will learn almost everything and they'll become an expert and share it with the world, and For others, it may look exhausting, but they're thriving on it as well. So as you said, autism and ADHD are conditions. They are absolute strengths when the conditions are right, when the environment is right for them as well. And some of the best things have happened because of those conditions. I have a patient who has both autism and ADHD, which can coexist, and clearly tells me, I know the days when I love my autism and ADHD, and I have days when I want to manage them. And I know how I manage them because I've got all the tools with me. But I choose when I want them to be in control, and when I choose when I want them to be just unleashed. And that was quite a fascinating insight that he gave us. So that's why I think consultant psychiatry, at least to say, let's reduce the burden of every other aspect that is there. But also, one of the other important bit I think as doctors we need to be very supportive of is, we use this with patients a lot of times, is I'm okay and you are okay. This is nothing to worry about. It's just about understanding and working through it. Until now, you have tried to fit into the world's needs. Now you get the world to fit into your needs.
David, just moving that on then, what's the role of the psychiatrist in supporting someone with ADHD?
Okay, so assuming you've done the diagnosis and assuming that somebody has a diagnosis of ADHD, I would often then say to the patient, well, what should we do about this? And I can tell them about the tools that we have available to us often actually that's enough for the person just to have that kind of self-awareness. Like you talked about self-awareness, and that's actually a really powerful thing to have that self-awareness. Often that's enough. There is so unlike autism, there is pharmacological treatment available for ADHD. So you can give people medication which will, I talked about that deficit of the dopamine in the prefrontal cortex. So we can actually correct that, and we can increase the amount of dopamine in that prefrontal cortex, which will help with the emotional regulation, help with concentration, and reduce the hyperactivity. So we can actually modify that with medication. And so what I would do in clinic is I would sit down with somebody and talk to them about the pros and cons of medication and what the titration, because we start off with a very low dose and then we monitor that dose as it goes up, checking things like blood pressure, weight, height, if they're still growing. But it's a process and it's a journey, and I do think it's really important to make sure that if people are choosing to start medication, that it's a really well-informed decision, and particularly at the moment, because what we're seeing is it's very difficult to get hold of medication, and the supplies of medication are quite inconsistent. So I would usually want to spend a good amount of time with somebody, counselling them, making sure they understood what that journey is going to look like, and if they want to take that path. And if they don't want to take that path, that is completely valid, because there's all sorts of other incredible support that's available, like with therapies, or even just environmental adaptations, using kind of tools like diaries, notifications on their phone. There's various apps again that are coming out to support people specifically with ADHD. There's services like body doubling, body shadowing, because again there's this phenomena that people with ADHD, when they're left by themselves, they really struggle to complete tasks. But in a group environment, or if there's other people with them, they find it easier, if they know that they're being observed, to complete the tasks. Maybe it's the kind of the social expectation makes them conform to complete the tasks. And then also kind of is it the Pomodoro technique? Yeah. The Pomodoro techniques, another kind of technique that people use to break tasks down essentially, to make it less overwhelming, less daunting, and to make it just a little bit more granular, and then give themselves breaks in between. So I guess that's how broadly how I break it down for patients, like pharmacology, medication, talking therapy, coaching, and then I guess environmental kind of adaptations that maybe your employer or school might make for you.
Mm. And I think it's a really important thing, and something that I learnt recently around the medication is there for ADHD, like you say, not so much or not at all for autism. But even if I kind of hear some people say, oh, I need medication for my ADHD, and they might get medication, but actually that's going to help you regulate and concentrate, and with the whole kind of brain kind of changes. But then I believe then that therapy or life coaching or whatever else you need to then engage with can help you then learn what to do with that new skill and that new time, because that might be quite a big change for someone. Suddenly they can be a bit more focused and be more concentrated, and actually now how do I make the best of that? When is the best time for me to take the medication? How I can maximise that in terms of my daily demands. So I'd be really keen for people to understand that you need something alongside the medication, because that will then optimise the effect of how you might go about your daily life. Yeah.
So, as we've done before, we always get some questions being sent in, and we're going to have a run through these, get the panel's view on some of the questions, which I think are always really insightful when we get these questions coming in. So, I think we've got one from Caitlin, which we sort of covered a little bit earlier on, but I think it's really worthwhile to go back over this. So, Caitlin asked, these phenomena are labelled as disorders. Does the panel think that it's a helpful thing to call things like ADHD or autism a disorder? So, Samir, we're going to start with you on this.
Disorder is how we all started talking about it. I don't think it does the full justice, but at the same time I don't want to move away from it, because when you have these, as I said, these conditions sometimes come with a baggage, and if they are neurotypical or neurodiverse and others conditions, but if we don't recognize the impact of it in this current world, we might miss the idea as well. They are conditions that can lead to other disorders. That's how I would look at it.
Okay. David, any thoughts around, is disorder an okay term to use?
So I was once on a podcast where I was asked this same question, and a snippet was shown, and it created so much debate online about whether or not we should be calling this a disorder or not. And it's difficult because to some people, it's like beauty is in the eye of the beholder, right? So I often will say to my patients, how do you perceive this? You know, what do you think of this? And that's actually, in some ways, that's actually the most important thing, is how they perceive ADHD or autism. And but the reason why I think it's controversial is because for some people it can be enormously distressing, and it can be really upsetting for them. So to deny them that word disorder can feel undermining, and that's what I've seen and heard from some people, that actually some people want to use the word disorder because it validates the distress that they've experienced. But then there's other people who would say this isn't a disorder because this is a variation of the norm, just like we have some people that are left-handed, some people that are right-handed. And if you've grown up your whole life as being left-handed, but everybody's making you use right-handed scissors, it's going to be really difficult. And it's not that there's anything wrong with you, it's just that the world is designed for the majority and you're in the minority that are left-handed. So it's a really difficult question, and it stimulates a lot of controversy. And so that's why I kind of duck out and I say, well, what do you want to call it?
Well, let's see how Debbie goes around this one.
Okay, so my response to that would be, it makes sense in terms of when it was created and what we understood about the world, therefore it was called a disorder. So that makes sense to me why it was given that name. I think if we were starting from scratch now and we were then reintroducing this as a diversity, a difference, I suspect probably we wouldn't use the word disorder. I think probably we'd use some different language. So I think we're trying to test something that was given a name in a very different setting, in our current setting, and it creates tension, doesn't it? So I agree, whatever it means to you is a helpful thing, but I can see how if lots of printed information has the word disorder on it, it can trigger something in you. But again, as a therapist, you can learn to separate yourself from that, and it can be meaning to you what it needs to mean to you, and you can just park that. You don't need to attach yourself to that name if it doesn't feel helpful. So if Caitlin, if she's got an issue with that, I would get her just to ditch it and she can call it something different.
I think we could debate that point all day.
Oh yeah,
I
I was going to respond then actually.
It's very interesting, isn't it? We talked at the
interesting.
beginning about that huge increase over the last 20 years. And I think, purely if I reflect from my career, it just goes back quite a long time, we didn't even discuss anything around ADHD, neurodiversity. They weren't terms that were used. I think that the language and the perception is really changing very quickly around it. Right, okay. Debbie, I'm coming to you for this one. This is from Susanna, who describes herself as a confused ADHDer. Okay. I read somewhere that ADHD and PTSD symptoms are very similar. How fine is the line between them? Are they intrinsically linked, or can you have one without the other?
Gosh, I didn't want to ask her more questions to understand what that looks like for her. I mean, PTSD is a very complex presentation where I guess you've got that hyper sensitivity to situations. You respond quickly, so I can see a little bit of what she's saying. I think she needs to go and see somebody who professionally could maybe unpick that with her, maybe just to explore that a bit more for her, because maybe she does have some trauma in her background that's activating those behaviours. So I'm going to say maybe, depending on what her backstory is, but not necessarily on paper.
So let's pick it up with either Samir or David, because part of that question is almost, can I have ADHD and PTSD? Or actually, does my ADHD mean that I'll never get PTSD? Or does my PTSD mean that I can't have ADHD? I mean, it's really complex, but diagnostically, can they sit together?
Yeah. So I like what she thinks that's confused ADHD. I like confusion, because you ask questions, you're curious about it. Now, ADHD and PTSD can coexist, and they can exist independently as well, and you can have one or the other as well. They're biologically different or psychologically different, especially PTSD. However, we know from evidence, and it's convincing evidence, that those who have ADHD have a higher chance of not being able to process trauma like someone who doesn't have ADHD, and they're usually 3 to 4 times higher chances of developing PTSD. And sometimes if they're PTSD but undiagnosed ADHD and they've gone through lots of therapy, they may be able to come through to terms with some trauma, but not all of it, because the processing hasn't happened properly because of that. But once they have been treated for ADHD or managed, and they have done therapy again, they have some brilliant results as well. So there is a lot of evidence to say higher chances of PTSD amongst patients who are, or individuals who have ADHD. So they can coexist and independently as well.
David?
Yeah, I mean, that's a really good answer. I guess the other thing I would just add as well is just to remember that ADHD is a neurodevelopmental condition. So you've always had an ADHD brain. So, because occasionally I'll have people come in the clinic saying, I've got all of these new symptoms that have just started over the past, I don't know, couple of years, and I'm finding it's difficult to concentrate, or I'm finding that difficult to regulate my mood. I think I've got ADHD because I've been seeing it on TikTok. But then you look at their childhood and they've had no symptoms throughout childhood. So it's just to remember that ADHD is a neurodevelopmental condition that is lifelong, whereas PTSD, there's a specific trigger, and the symptoms that you experience will occur after that specific trigger. But I do think this is why I do think it's important for people to come and see people like us to get that diagnosis and to read as much as you can online. But there's a real danger that people misdiagnose themselves, and if you don't get the right diagnosis, then you don't get the right treatment. So that's again, I encourage people, if you, like Samir said, if you're curious, that's a really good thing, and learn as much as you can, and get that diagnosis done formally by the right people.
Brilliant. Right, last question. I think this is going to be as controversial as the first one. So, Rachel's asking, things like ADHD and autism are often labelled as a superpower. What do the panel think of terms like this? Is it helpful or a hindrance? I'm going to start. You're all avoiding looking at me now. So I'm going to start with Samir.
Superpowers, I think, as individuals or people, we all have superpowers or power, and that is how we think or perceive things. So yes, ADHD, autism, not having ADHD, autism, it's all superpowers. It's what we do with those powers. But at the same time, I don't want to minimize the impact that autism, ADHD can have in the current environment that we have, which sadly is not going to change in the wider scheme. Because when we talk about superpowers, we talk about people that individual with superpowers can manage everything, and they are there to survive, not only survive for themselves, but they can protect others. I don't want them to feel that way. I want them to feel superpowers for themselves, that they can achieve anything and everything that they're capable of. All they need is the incline to come down by whichever method that it can be. But I don't think it's superpower for other people. They should not be, I won't minimize it, but at the same time I would use it if it's right for that individual.
Okay. Debbie, superpower, useful or not?
I'm in Marvel space now, because superpower is a Marvel kind of, I'm a big Marvel fan, and that comes with responsibility, doesn't it? And it comes with expectations. So I think there's a danger we're going too far maybe with the language. I think it has got strengths, and there are people therefore that can do certain things well or better than others. I think it's a tough label to say it is a superpower. I think it's got strengths, which is a slightly more sits better with me in terms of the language. But otherwise, we're expecting them to be better or different, and that doesn't feel okay either.
And let's link that a little bit, because when I come to you on this, because a little bit of an adjunct to that question, you talked earlier on about social media. One of the challenges for ADHD, autism, quite often when we see in media, is here's the person with autism, and next to it is this perception of having the superpower that goes along with it. And that's quite often an associated thing. So we've put this person, yes, they've got autism, but look at how they've got this thing as well, and that's fantastic, isn't it? It's amazing. Is that helpful?
No. I don't think it is helpful. I had a young man the other day actually who said to me, I can't possibly have autism because I don't have a niche special interest that I know everything about. And so again, the irony is that he had this very hard, fast, concrete rules about what autism was and what autism wasn't. And because of something that he'd seen that if you have autism, you must have a niche topic that you know everything about, and this expectation that you're going to be very good at maths and science. And so because of a stereotype of what he had seen in this kind of almost pedestal that had been created for him, it almost robbed him of his diagnosis and of that understanding about himself. So again, I short answer is no. I don't think it's I don't think it is helpful, and I personally never use the word superpower, because I don't think it's my place to put that burden or expectation or pressure on somebody. But equally, if somebody feels that, oh, actually, do you know what, this is a superpower for me, and if that's how they view it, and if that's what it feels like and it is to them, then it's not my place to take it away either.
Brilliant. Thank you. I mean, I think they were fantastic questions, really thought-provoking. So obviously, thank you to everyone that sent in questions for us. Now, if you have enjoyed this, then please like it. And if you want to see more content from Priory, then also subscribe to us. So thank you again for watching.